So you should already have watched the Foster-Kennedy video to know that the presence of optic disc edema in one eye from papilledema, from increased intracranial pressure, in combination with optic atrophy in the fellow eye from a compressive optic neuropathy, usually due to a frontal lobe or other large meningioma, produces the true Foster-Kennedy syndrome. However, there's a pseudo-Foster-Kennedy syndrome, which has the same ophthalmoscopic appearance, optic disc edema in one eye and optic atrophy in the other eye, but it's from NAION or some optic neuropathy with disc edema in the past, and then they have a new event, say NAION in the ipsilateral eye. So this is a pseudo-Foster-Kennedy, this is a true Foster-Kennedy, and today we're going to be talking about how it can be pseudo-pseudo, which is, it acts like the pseudo-Foster-Kennedy syndrome, that is with optic disc edema in one eye and optic atrophy in the fellow eye, but instead of it being from non-arteritic anterior ischemic optic neuropathy, which is bilateral but sequential, there's some other cause for the disc edema and the optic atrophy. And so one of the scenarios that we see this in is in patients who have idiopathic intracranial hypertension, where they have papilledema in one eye, but it's asymmetric, and the other eye has had post-papilledema optic atrophy, and so they get treated and they get a recurrent disc edema, but the dead nerve can't swell, so it cannot manifest the bilateral papilledema, and so it looks like a Foster-Kennedy or a pseudo-Foster-Kennedy because it has disc edema in one eye and optic atrophy in the other eye, but really it's neither, and that is a pseudo-Foster-Kennedy syndrome from patients who have increased intracranial pressure. There are also other cases where the patient has another cause for disc edema in one eye and optic atrophy in the fellow eye, which has nothing to do with NAION. So those are cases of optic neuritis or inflammatory optic neuropathies of various types, syphilis, infectious etiology, sarcoid. So it's a pseudo-Foster-Kennedy also if you have that constellation of disc edema and optic atrophy from bilateral sequential optic neuropathies from non-ischemic etiologies. So you need to know about the true Foster-Kennedy syndrome, which is a tumor, the pseudo-Foster-Kennedy syndrome, which is not a tumor, but sequential bilateral NAION, and the pseudo-Foster-Kennedy, which looks like Foster-Kennedy or pseudo-Foster-Kennedy, but is from some other cause of disc edema and optic atrophy.